Medurstand-Understanding Medicine.
Professor Aziz or Rehman here, and I'm going to demonstrate the examination of neck veins, which is part of cardiovascular system. Now, a patient should be in this position, and there is a reason. I will actually make two videos for neck vein examination. First one is just the basic facts and to assess the central venous pressure, and in the second video, I will discuss how to interpret the different waveforms. So, patient should be in this position at 45 degree, and there is a reason. And the reason is that we actually want to assess the central venous pressure, and that refers to the pressure in the central part of the right atrium. And right atrium is actually, if we first identify the angle of fluid here, and about 4 centimeter below this, 4 centimeter below this point is the right atrium, central part where we want to assess the pressure. And in this position, you appreciate that this part almost corresponds with this base of supraclavicular fossa, this one. If you see horizontally, like this one, so both are almost at the same level. So that means, since normally central venous pressure is about 4 centimeter of water, and if there was a way to look at that column, it would correspond to the angle of fluid. And since this one corresponds with this one, the base of supraclavicular fossa, so it should be just visible here. But since we want to make the use of physics, so we have brought this point at the level of upper level of central venous pressure in a normal person. That implies that we should not be able to see any engorged neck vein in a normal healthy person. But if there is increase in central venous pressure, that would translate into engorgement of neck veins here. So this is the philosophy. Now let me say again, we want to assess the pressure, the central venous pressure, which is represented by right atrial pressure, and that point is 4 centimeter below this angle of fluid in this position, and this angle of fluid corresponds with the base of supraclavicular fossa. So we are actually looking at this point. So we can examine either side, but just to show you it better, I'm going to look at this one. So you turn the neck toward like this. Patient's neck should be relaxed. It should be resting here, and you see, and there should be proper light, and I don't see any engorged vein at all. So actually there are two veins, the internal jugular vein and the external jugular vein. Technically speaking, internal jugular vein is better because that empties into the subclavian vein and the superior vena cava without any kink, without any interruption, and it is a straight vein. So that represents central venous pressure more accurately. Whereas external jugular vein is more easily visible, but that has an angle before it enters the subclavian vein. So there could be at least theoretically reason that there may be engorged vein, whereas central venous pressure is normal. So in this case, I'll see carefully, and I don't see any engorged veins, neither internal jugular. Actually here I can see the pulsation. Pulsations are visible because they go beyond the upper column of the blood, but the engorged veins are not visible. So with this you can assess if there is increased central venous pressure, and then of course there are various causes, and you cannot assess if there is reduction in central venous pressure. So if there is increased central venous pressure, it could represent overall volume overload state, it could represent right heart failure, it could represent cor pulmonale, it could also represent pericardial disease. So increased central venous pressure is very, very important parameter. Now if I see the column, in this case I don't see any column, but if I do see, then I will have to measure how much is the increase in central venous pressure. Now I'm going to demonstrate you that. Suppose this is the point. Suppose I see a venous column here, and this is the upper level. So I will use two ruler or two pencil or whatever, two tongue depressor method to measure the vertical height. So pressure is actually measured in the vertical column. So how do I measure the vertical column? I will need two objects. Suppose this is the upper end. I will put this ruler at this level, and this should be horizontal in space. And then I will need another ruler which I will put on the angle of fluid here, and this should be vertical, right? So this part, the part below this one, this actually represents the vertical height of central venous pressure. So I would express it like, if I measure it, if this is 5 centimeter, I would say central venous pressure is increased by 5 centimeter above normal. Now if I add this one to the actual pressure, normal pressure, which is 4 centimeter, so central venous pressure may be expressed in absolute terms as 9 centimeter of water. So this is the importance of examination of neck veins. It represents condition of heart and overall state of hydration. In my next video, I'm going to discuss different waveforms and their interpretation. Thank you.